Ceann Comhairle, big efforts have been made to get our hospitals ready for a surge, very successful efforts. And very big efforts were made to make that surge as small as possible, very successful efforts. But the same efforts were not put into getting the nursing homes ready for COVID-19. As we sit here today, 7 in every 10 COVID fatalities in Ireland are from a nursing home or a community care home. Nursing homes are desperately short of staff and personal protective equipment. As one nurse, Ceann Comhairle, said to me earlier this week, many of our residents have psychological conditions. There is COVID in the air, there is COVID on the walls, there is COVID on every door. Our senior nurses are all out with COVID or are self-isolating. We can't get the staff and we can't get the masks that we need. Now, there are two contributory factors to why this has happened. As COVID began to move through our country, nursing homes did not have a voice with government and they did not have a voice with the National Public Health Emergency Team, NPHET. The government's COVID action plan from mid-March actually only mentions nursing homes once, and only then is somewhere to be used to discharge patients from hospitals. There's no mention of supports needed for nursing homes. So what of the Public Health Emergency Team? So according to the minutes available, Ceann Comhairle, from January to the end of March, the first time nursing homes were mentioned by NPHET was at their 12th meeting on the 10th of March. And at that meeting it was agreed, quote, that unilateral or widespread restrictions of visiting, which the nursing homes and some hospitals were implementing themselves, is not required at this time. So the first time nursing homes were mentioned by NPHET was essentially to say, stop with your own restrictions. It was another 3 weeks before the minutes show that NPHET agreed that action was required on nursing homes, right at the end of March. In fact, Ceann Comhairle, the minutes show that NPHET made a decision to close the playgrounds a week before it decided that support was needed for nursing homes. Minister, NPHET has about 45 members and 11 subcommittees. GPs, patients, people with disabilities and the voluntary sector are all represented. Nursing homes are not. They're not represented on NPHET, they're not represented on any of the subcommittees. Now, your position is that nursing homes don't need to be represented because they have now good access to you, which is fine. But Minister, you also said in your weekend interview with Hugh O'Connell that every single decision you are making on COVID is informed by NPHET, that there isn't a single decision you're making that hasn't been recommended by NPHET. And I'm not disputing that. But if that is what you're saying, then with the greatest of respect, while it is fine that the nursing homes have access to you, in terms of affecting policy, surely they must also have access to NPHET. So, Minister, my questions are two. Will you please, as a matter of urgency, give the nursing homes representation on NPHET? And secondly, can you say how many of the NPHET meetings you have attended, and how many of them have you brought up these concerns that the nursing homes have been raising with you? Thank you.